All the following are accepted method control of epidemics except A. Mass vaccination, B. Health education, C. Mass chemoprophylaxis, D. Isolation of cases. See, epidemic control measures include early detection and prompt treatment. So, early detection and prompt treatment is needed. Then, vaccination for diseases for which vaccination exists, vaccination measures should start. Then, health education to prevent and reduce disease transmission definitely is needed, and sometimes isolation of cases to prevent disease spread is also needed. Mass chemoprophylaxis, which involves providing medication to large group of people who might be at risk of disease but are not necessarily ill, is not always an accepted method of control of all epidemics because it is very costly, and its application needs to be very specific depending on the disease, the context, and the risk of side effects versus benefits, which should be understood before giving mass vaccination. So it is going to be really difficult and not needed, very cost effective, very costly intervention. So better to avoid this. So the correct answer for this question is mass chemoprophylaxis is not needed. Remaining all three measures will be useful in epidemics.